And so that image is streaming. And then we're live.
Hello there. How is everyone doing? Welcome to our show, Truth with Teeth. Here I think we are probably like in the 6th or 7th month since we started last year. Thank you all the followers, and we welcome you to our show, and thanks for watching it. And here we go, going live to answer all your any questions. So any questions that you guys have, feel free to just put it on the Facebook Live or on the YouTube Live, and we'll try to get as many questions answered as possible tonight. And I have Reese joining me tonight for the Facebook Live. Thank you very much.
All right, so let's start it off hot with our top question tonight. It is followed by how do I detect mouth cancer?
Okay, the question is, how do I detect mouth cancer? So I get this question a lot, and some people know how to detect a cancer, and some people don't. Imagine, like, for women, for example, like they always recommend, well, if you're probably like you need to you need, whenever you have like a lump or bump in your body, you just need to keep feeling for those lumps or bumps. For example, breast cancer is very common. you may have. Thyroid cancer is like another common thing, so you need to be feeling for any type of lump or bump that you may feel around the neck, or not necessarily either the thyroid or the breast, like any type of lump or bump that you may have in your body may be an indication that you may have a cancer. That applies to the oral cancer also. Just because you have a lump or bump in your neck, that doesn't mean like you may have a cancer in that particular spot. Sometimes the oral cancer may present as a lump or bump on your neck or your chest or anywhere in the body. And then the other common symptom or the sign of the oral cancer is a sore spot. So particularly if you have a sore spot, like sometime you may get a sore spot either from bumping toothbrush onto your teeth or your gums, or you may have a hot cheesy pizza or something really hot that kind of makes a sore in your mouth. So you may have a sore. Most likely these traumatic ulcers or traumatic sores, they go away in about a week or 10 days. If you have anything last for more than like a couple of weeks, and that's an indication that possibly you may have some type of a cancer going on. Not necessarily, but at least you will need to get that checked out with the dentist. So the most common symptoms for oral cancer are either what we call it as a non-healing ulcers. The ulcers do not heal in a period of like 2 to 3 weeks, or the lumps or the bumps or swellings. Those are the two most common things that we find that are related to oral cancer. So if you find any of these things going on in your mouth or your head or neck or in your body somewhere, make sure that you're going to talk to your dentist to see whether you are at risk for any type of oral cancer or not. I hope that answers this question.
All right. So let's go to a question coming from Amy. And it comes from our website, and it is, will it be bad for a 29-year-old to want to get implants?
So the question is, will it be bad for a 29-year-old to get implants? No, not at all. So we have patients as young as maybe about 10 or 12 years, they are needing implants, or maybe even younger than that, but not necessarily we will be able to place those implants, because unless until people complete their growth period, we do not recommend placing the implant. For example, for the girls, the age could be around age 15. For the boys, it could be around like about age 16 or 17, which is when they complete the growth period. We recommend placing the implant. So for a 29-year-old, absolutely not. The reason I told you people can be as young as about 10 or 15 years old, because sometimes you have some teeth that are missing. Either the permanent teeth never comes through, or you may have some knocked out teeth from a sports injury or from other reason, or you may have had some bad cavities. So for a variety of reasons you may be missing teeth. And so when you have those missing teeth, it's not uncommon for people or patients to need implants, and they could be as young as maybe about 10 or 15 years, but we don't recommend placing implants at about 15 years or so. And again, to answer your question, 29 years old, absolutely, you are not. It's not a bad age at all if you're going to get implants, and my recommendation is you strongly consider getting implant, because any other alternatives that you will consider being this young will be devastating, because you're going to have a tooth that is going to be lasting for a lifetime if you're going to get dental implants.
Alright, so you're never too young to get implants, it seems. Alright, so our next question comes from Cora, and it is, what is the difference between mouth cancer and oral cancer?
So the question is, what is the difference between mouth cancer and an oral cancer, you said, right?
Yes,
so,
sir.
so mouth cancer and oral cancer, I thought it's a mouth ulcer. Is it this one right here? What is the difference?
Right here underneath.
Okay, so the question again is, what is the difference between a mouth cancer and an oral cancer? They are one and the same. Mouth, we call it as an oral cavity. So anytime you get an ulcer or any type of cancer in the mouth, we call it as an oral cancer. So they are one and the same.
Next question?
Yeah, okay.
All right. Let's go to another question from Cora. And it is, do you absolutely need a crown after a root canal? I had a root canal in 2010 and I didn't get a crown, just a permanent filling. The tooth has been fine ever sense, but every dentist I've met keeps urging me to get one. And this one is followed by 7 people.
Okay, so the question is, do you absolutely need a crown after a root canal? I had a root canal in 2010 and I did not get a crown, just a permanent filling. The tooth has been fine ever since, but every dentist I have met keeps urging me to get one. So the simple question is, do you need a crown after a root canal? Or if you did not get a crown after a root canal, how long can you get away without getting a crown after a root canal? So the simple answer is, depending on where the tooth is. If it is in the front of the mouth, for example, you can get away from not having a crown at all for as much as you could, maybe 10, 15, 20, or maybe even for your lifetime. But if you do have a back tooth that you had a root canal, and that may need a crown as soon as possible or as soon as you complete even the root canal. The reason being, anytime you get a root canal, as you know, the root, the nerve or the blood supply from the nerve is being taken out, and that's why you call it as a root canal, because you get a filling in the root of the teeth. So because you get those, the teeth become kind of really brittle. So anytime you put more force onto, just like you are using a regular tooth, then the tooth is going to fracture if you don't have a crown on on that particular tooth. So that is why it is so critical that you need to get a crown after a root canal. But for the front teeth, because you don't put as much of a force, because whenever you're biting, so you may not need a crown. So again, it really depends on the case, and sometimes we do see even the front teeth, they need sometimes they need a crown because they are starting to change, the color starts to change. So depending on the situation, more than likely if it is a back tooth, you will need a crown, and if it is a front tooth, you may not need a crown. And in this follower situation, it looks like he probably had this root canal done in 2010, and if it is a back tooth, more than likely most of the dentists are going to recommend the patient gets a crown. And again, in the best interest of the patient, and we always recommend patients do get crown for particularly the teeth with root canals on the back. Hope this answers your question.
All right, so it seems like the crown's just some extra protection.
That's exactly right, particularly for the back teeth. Yes, sir.
All right, so let's do another question from someone. This one comes from Maria, and it is, how do you make dental treatments accessible?
So how do we make dental treatment accessible? Well, we want to make the treatment accessible to every single patient as possible, depending on how the reader wants me to answer this question. The finances to make it accessible to everybody, and in our office, the way that we make the treatment accessible to most of the patients that we have is by offering, for example, a free consult and a free consultation and a free CAT scan that every patient that comes into our office gets. And then also we do have lots and lots of payment plan options that we have available when it comes to the dental care. So every single office that you go to, they have some type of either some specials or offers or something that they are able to help their patient population. So just depending on where you live and which part of the country or which part of the world that you live, check some local dentists out and then see what kind of offers and what kind of payment options and what kind of payments that they have available, and you should be able to get access to dental treatment as much as possible. And depending on the answers you get, you can talk to them about the type of insurances and type of discount plans and the payment options, and there are multiple options available. And I hope this answers your question.
Yep, we're always looking to help any patient that is looking for some help. Yeah,
absolutely. If you're in the Dallas-Fort Worth area, come and see us, and our consultations always come for free, and all the consultations always come with a free CAT scan. That's about a $700 value that you won't be able to get anywhere else in town.
All right, moving on. Let's see. This question comes from Cora again, and let's see. Can mouthwash with alcohol cause oral cancer?
So it looks like we got a lot of questions related to oral cancer, and I'm assuming next month is going to be oral cancer month, and that's one of the reasons why people are probably reading more about the oral cancers, and they've submitted this question. Actually, this month, sorry, I'm just still thinking I'm still in March, but this month is actually Oral Cancer Awareness Month, and that's why they're getting a lot of questions on oral cancer. So anyway, going back to the question, can mouthwash with alcohol cause oral cancer? The answer is no. So just by using a mouthwash with alcohol in it, that is not going to cause oral cancer. Some people may be thinking, well, I'm a maniac and I'm a germophobic, and I use mouthwashes like 5 or 10 times a day, or maybe even more than that. But even by doing that, you are not going to cause any damage to your mouth, at least to the level that you're going to cause any oral cancer. but sometimes you may feel like some skin is peeling off from inside the cheek and things like that. But if you're specific, or if you're concerned about you may be seeing something or seeing some signs of oral cancer because you're excessively using the mouthwash, check with your dentist next time when you go and ask them to check and see whether you may be at risk of getting some oral cancer because you're using a particular mouthwash. One of the common things that I recommend most patients do, and you may be relating this follower may be relating the question to because they are using an alcoholic mouthwash, and that's the reason why they may be thinking that the mouthwash is going to cause cancer. There are several options that you have available. For example, Listerine has a mouthwash which is called the Listerine Zero. That does not have any alcohol, zero alcohol in it. And also Crest Pro Health, for example, that does not have any alcohol at all, zero alcohol. So if you're going to use a mouthwash that does not have any alcohol in it, you don't have to worry about it. And the mouthwashes with no alcohol in them, and they have been shown to be as effective as mouthwashes that contain the alcohol. So if you're ever concerned about a mouthwash causing oral cancer, pick something that does not have alcohol in it. Walk down the aisle at your departmental store or your drugstore. There are several options available that you have, and you should be able to see a mouthwash that does not contain alcohol, and that's the best answer to your question. So pick something that does not have any alcohol. Does it make sense, Reese? Yeah.
Makes sense. Plenty of options. All right, let's keep going with some cancer questions. This one is also from Cora. It's followed by 8 people. What is the difference between mouth cancer and a mouth ulcer? Is mouth ulcer a starting point for cancer?
Great question. So, what is the difference between mouth cancer and a mouth ulcer, and is the mouth ulcer a starting point for a mouth cancer? Absolutely. So, the mouth ulcer could be a starting point for a mouth cancer. So just like we addressed earlier, most of the oral cancers sometimes may be preceded by an ulcer. So anytime we see an ulcer, we kind of try to define it, or we try to see that in the mouth as whether this cancer whether this is an ulcer which is a non-healing type of ulcer, which we talked about earlier. Anytime you have an ulcer in the mouth, for example, like if it is a pizza bone and you have the ulcer that heals in about 2 to 3 weeks. If you have an ulcer that is lasting for more than 2 to 3 weeks, and that immediately is it's a warning sign for that, could that ulcer be an oral cancer. So yeah, for the most part, the oral cancer will be preceded by a mouth ulcer, but not necessarily. Sometimes you may not be able to see as an ulcer, and you may not be thinking it is an ulcer, and you may still have an oral cancer. But the question becomes, whether the oral cancer and the mouth ulcer, are they the same? No, they are not the same. Mouth ulcer will heal, the oral cancer will not heal, but more than likely mouth cancer will be preceded by a mouth ulcer. And I hope this answers your question.
All right, moving on. Let's see. This question comes from Teresa, and it is, do you have a payment plan if I don't have insurance?
So, great question. So, do we have a payment plan if we don't have insurance? So that is not the question, just not from, this is only one follower here, but this is one of the most common questions that we get asked a lot. We get asked a lot when the patients come here for treatment, when the patients call our office on the phone, like, they ask this question. And this is one of the most common things, and when we are talking about the accessibility to dental care, and most patients think of the same question most of the time. So again, not necessarily just our office, any dental office that you go to, they have some kind of a payment option that they have available depending on the level of treatment that you're going to need. So the question becomes, whether you have any payment options available. Not necessarily my options. In my office, we got tons and tons of payment options that we have available. And any dental office that you walk into, most offices will have some kind of a payment option to make the treatment accessible and to make the treatment affordable. And I'm sure most the doctors would be able to even kind of custom make a treatment plan for you that fits your budget, and that's what we are here for. We are able to help our patients, and we do that every day. We are able to find a treatment that fits their budget and lifestyle, and still being able to help them to get out of pain or get some nice smile and everything. And I hope this answers your question.
Yeah, because at the end of the day, we always want to improve their smile.
Absolutely, yes, sir.
All right. So this question comes again from Cora. What are some possible negative side effects of having wisdom teeth removed?
So the question is, what are some negative side effects of getting the wisdom teeth removed? There are many positive effects or any benefits of getting the wisdom teeth removed. Of course, no procedure comes with no side effects. So of course, there are some side effects, and any surgical procedure that we do, we can talk about like zillions of complications that can happen. Pain, swelling, infection, and delayed healing, and all of those. Those are things, what we call it as a immediate or a short-term complications, which most of the time that they just get better. Some patients may just get better like in a couple of days. Some patients may take about a week or 10 days for them to get better. Again, those are like short-term complications that may happen. Most of the patients that are fine. But one of the most common complications on the chin or the lip goes really high. Most of the time, depending on the age of the patient and depending on the severity of the impacted tooth, most of the time this numbness could be temporary, but very rarely these numbnesses become kind of permanent. That means you won't be able to feel the chin or the lip or even sometimes the tongue properly after the wisdom teeth removal. So again, talking about the complications, like I said, most of the complications are temporary, and this is one of the most common complications that might happen that could become permanent. But for the most part, the wisdom teeth procedures are pretty straightforward. The chances of these complications to happen is very rare, although it is rare, but it can happen, and that's one of the most common complications that patients are more concerned about than anything else, because the other ones are very easy to handle.
All right. So this question again comes from Cora, followed by 4 people. At what approximate age are human teeth designed to fall out if it were not for the advantages of modern dentistry and oral hygiene practices?
So the question is, at what approximate age human teeth are designed to fall out if it were not for the advantages of modern dentistry and oral hygiene practices. So this I want to see whether I can break down the question to maybe multiple parts. Okay, so at what age, approximate age, the human teeth are designed to fall out? The teeth are going to last for your lifetime if you're going to take good care of them. I have seen patients who are 100 years old. The oldest patient that I've treated in my office is 106 years old, and today actually we saw a patient in my office. She's actually, I want to say 89 or 92, and she had pretty much probably about 10 or 12 teeth on the top, and then maybe about 20 teeth in the bottom. So there is no age limit for how many teeth you can have at a particular age. So you can have as many teeth as you would like. And I have all my 28 teeth except the 4 wisdom teeth. Knock on wood, I'm nearing 50, and I have all my teeth that are lasting long, and I hope to have all my teeth for the rest of my life. So the question becomes, so those are not designed to fall out at any age at all, as long as you take good care of them. The second part of the question, if it were not for the advantages of modern dentistry and oral hygiene practices. So again, the only way that you keep your teeth is because of modern dentistry and the oral hygiene practices. So if you are thinking that you don't want to do a good job on brushing or flossing your teeth, or you don't want to go for professional cleanings, and you don't want to take care of any other dental treatment that your teeth may need, so then the teeth may fall out as quickly as I've seen, like a few months, as quickly as could be a few years. So to answer your question, if you take good care of them, then they are going to last for a lifetime. If you don't take good care of them, whether it is because of the poor oral hygiene or because of the poor dental care, then you may end up losing them in a few weeks or a few months or a few years, and really depends on the person. But think about this, not necessarily I'm talking about losing all the teeth. You may end up losing a few teeth, and which may not be a big concern depending on the people that we meet. We got some things that we are dealing with. Some people, for them, for someone who loses a front tooth, that may be a big issue. For somebody who loses their back teeth, they're not as concerned. And some people, they lose teeth just on one side, and then they're not concerned because they have the teeth on the other side to be able to chew. So again, depending on what is your goal and how good you want to keep your teeth. So to answer your question, yes, the teeth can last for a lifetime if you take good care of them, and if you don't take good care of them, you could lose them in days or weeks or even months or even years. Yeah.
Treat things you like well.
Absolutely. Yeah.
All right. So let's see. Let's do another cancer question. Here we go. Can oral cancer be treated effectively? I mean, be cured completely. It's followed by 5 people.
Okay. So the question is, can oral cancer be treated effectively? I mean, cured completely. The answer is yes. So think of it as, for most people, like it could be a skin cancer. Cancer is cancer, right? So some people think that, well, I have skin cancer and I went to the doctor and they removed a piece of my skin and I'm fine, right? So when you hear the word cancer, so immediately you start to think, like, how risky it is. Skin cancers are sometimes not as risky as any other cancer. Sometimes whenever you talk about cancers, there could be some benign cancer and then some malignant cancer. So the malignant cancer is very serious, whereas some benign cancers, they are not as serious. We talked about the signs of having some cancer. Sometimes I do see patients, they have a small lump in their mouth, and immediately when I see that, patient is not a smoker, patient is not they don't drink, and patient is a very young patient, and they say that, well, when I was chewing and I remember biting my lip, and it's a swelling, and sometimes when you look at it, and it's kind of looks benign. And although we always, whenever we remove any type of lump or bump from our body, we always send it for a biopsy, but for a lot of times we are able to reassure the patient just by looking at it, hey, I don't think it is cancer, but let's get it checked out and let's send it for a biopsy. That's what we normally do. However, the question becomes, whether what was the we were answering right here? Sorry.
Can oral cancer be treated effectively? I mean, be cured completely.
Yeah. So whether it can be cured completely, in this case, for example, right? So if it is a benign cancer, then you just by removing it and you're able to cure it completely, and the chances for that to come back is very unlikely. Even if it is a malignant cancer, sometimes if it is a smaller piece, so sometimes you remove it and it is possible that you may be able to cure it completely. Sometimes, depending on the size of the cancer, we take a small sample if we think it is malignant, and we may be able to take a small sample of the tissue, then we send it out, and then when it comes back and if we find out it is a malignant cancer, we are able to remove a bigger piece of it, and then sometimes I see patients, they get no problems at all, and everything is cured completely. Sometimes we see bigger chunks of oral cancer that happen, that sometimes goes into the neck and things like that as well, and we have seen and we have been able to treat patients very effectively, and they got no recurrence whatsoever for the rest of their life. Some people we have seen live for 20, 30, 50 or maybe even 100 years. So to answer your question, is oral cancer curable? Yes, the oral cancer is curable, and there are multiple options available when it comes to treating oral cancer. For example, doing a small biopsy. We call the biopsies as incisional biopsies or excisional biopsies. You got laser treatment, you got radiation, you got some chemotherapy. There are multiple options, and to completely cure the oral cancer. Yeah.
All right. So let's see. Let's do another question from Cora. Let's see. Is it safe to get a dental implant after a month of tooth extraction? I met 2 dentists. One says get it done after a month. The other says after a minimum of 4 months.
Okay. So the question is it safe to get a dental implant after a month of tooth extraction? I met 2 dentists. One says to get an implant after a month. The other says after a minimum of 4 months. There is no real right or wrong answers to it. It really depends on the preference of the dentist or the implant specialist or the periodontist or the oral surgeon who's placing the implant. They are going to kind of differ on the type of practice philosophy they have. So to kind of like go back to the possible options, so whenever you have a tooth to be removed, the best and possible time that you want to put that implant in there is at the time of the extraction. As you know, that is what we do in our office. So a lot of time I'm able to remove a tooth. For example, right here, this tooth, if you look at it right here, and this is a tooth right here in the front. This patient has a lot of teeth in the front, and if it is a front tooth, a lot of times we are able to remove the tooth and put the implant in at the same time. Sometimes we were able to put the temporary crown also at the same time. So if you are able to put the implant at the same time, so realistically the answer becomes either you can go back and put the implant in a month, or you can go back and put the implant in 4 months. So it really depends on the type of the tooth, and what is the status of your mouth, and what is the status of the tooth that came out. And so it could be multiple factors that could be a decision maker on to decide whether immediately, or maybe after a month, or after 4 months, or maybe sometime even longer than that. Not necessarily it's always a cookie cutter deal that you may be able to get the implant within like a month to month 4. Sometimes I've seen we have to wait for as long as about 6 to 9 months before the implant goes in for the infection or any other type of bone grafting patient may need that may need to be healing. So the question is, it could be as low as about same day, or it could be as long as like about 9 months to a year before you could receive the implant. But most of the time we are able to do the implant successfully no matter what it is. Yeah.
All right. Let's go right under there. If there is not enough bone for a dental implant, what are the things one needs to be careful of when undergoing a sinus lift?
So I think I partly answered this question on the previous question. So if there is not enough bone for a dental implant, what are the things one need to be careful of when undergoing a sinus lift? So what the person means by sinus lift is a type of bone grafting some patients need when they are going to need a dental implant. This is the most common occurrence that happens in the back teeth on the upper jaw, right here, either on the right side or on the left side. So whenever you lose some teeth in the back, so the sinus always encroaches upon the space that teeth used to sit on, and now you're going to end up having to have what we call it as a sinus lift procedure or a sinus bone grafting procedure to be done. So the longer you're going to wait after the back teeth are extracted, the chances of you to have a sinus lift is very likely. So you want to have, anytime you have a back tooth extracted, you want to get the dental implants placed as soon as possible, like maybe about 3 to 6 months, or like a 6 months to a 9 months window. Otherwise the chances of that happening, the chances of you needing a sinus lift is very high. As far as what are the complications that could happen, or what kind of things that someone need to be careful of, you will need to talk to the implant specialist or the implant surgeon, whoever is going to be placing the implant. For the most part, the sinus lift is a very, very, very safe procedure. Most patients do not have any complications at all. And I've been doing this procedure for almost over 20 years now, and I have not had, knock on wood, I have not had any patients with serious complications. Although I see like some patients have some kind of a chronic sinusitis, and sinusitis, it happens for a while again, and then it tends to kind of go away. Again, you have multiple factors that you're dealing with. I tell my patients all the time, hey, here we go. We live in Texas. Sometimes we have a temperature ranging from, weather goes down from 20 degrees one day, and then next day we got 80 degrees. We got weeds all the time in the pollen all the time in the air. That could be contributing to the sinusitis you have, not necessarily like you had a sinus procedure done which sometimes patients have a tendency to, they have a sinus complication, they try to relate it to a sinus procedure. But long story short, anytime you have a sinus procedure done, a sinus lip bone grafting done, about 99% of the time, in my opinion, we are able to do it very safely, although the chances of the complications happen very likely, but you can have chronic sinusitis and things like that, which is one of the most common complications that I see. Although, you may have some chronic sinus pain and chronic discharge and all of that, these are again like very rare occurrences in my opinion.
All right, moving on. Second page. Many seniors lose teeth due to gum disease and getting implants. Will the gum disease cause the implants to loosen and eventually fall out?
So the question becomes, many seniors lose teeth due to gum disease and getting implants. Will the gum disease cause the implants to loosen and eventually fall out? The answer is absolutely. Think about that. So the follower already mentioned that many seniors, are they aware that many seniors lose their teeth because of the gum disease. So the gum disease happens for a variety of reasons. Either it is because they don't have a good oral hygiene practice, they don't brush or floss their teeth properly, or it is possible the reason the access to the dental care, they are not following through with their dental treatment, with going back on to the dentist for a regular basis for a professional dental appointment. So if you have lost your teeth because of the poor or lack of dental care or poor oral hygiene, and the same gum disease that happens can happen around the dental implants also. This is what I tell my patients all the time. Dental implants are great, and they are metal, they are made of metal. The great thing about the dental implants is they look, feel, and function like a natural teeth. Great thing again, they don't get any cavities because they are metal. They don't get any root canal because they are metal, but they can get some gum disease around them because you cannot control the gum disease and they are not foolproof. So you will get some gum disease around them, and again, if you don't take care of the implant properly, you will end up losing the implant, particularly from the gum disease. And I hope this answers your question.
All right, let's keep it gum related, and let's go back to that first page. I brushed my teeth using the modified Bass method, and it caused my gum to recede. What should I do?
So the question is, I brushed my teeth using modified Bass method, and it caused my gums to recede. What should I do? So the modified Bass method is one of the methods, one of the several methods that are available. You can brush your teeth. I'm not going to get into the name much. The bottom line is I want to keep it simple. There are two ways you can brush your teeth. One is if you want to keep scrubbing your teeth. For example, if this is your teeth, you don't want to keep scrubbing your teeth, and that is one of the most common reasons why I see that patients are going to end up having some receding gum. What you want to do is you want to go around the gum line. You kind of like want to go from what I call it as a vibrating motion. So you want to go underneath the gum line, but in a vibrating motion, but not scrub the gums away. And this is a Sonicare toothbrush, what I call it, or any type of power toothbrush, and which is one of the common things that I recommend. And again, going back to the scrubbing technique, when you scrub your gum tissue, and you're going to apply a lot of pressure, and the pressure may differ from patient to patient. If you are somebody you are applying a lot of pressure, and particularly you are scrubbing your teeth away, scrubbing your gums away, then absolutely you are going to get some gum receding. But if you are going to use a power toothbrush, for example, something like this is a Sonicare, and I don't think you'll be able to hear this noise, but whenever you do use a Sonicare, depending on the type of pressure you're putting in on the toothbrush, and you should be able to feel it. The noise will differ. So if you're putting a lot of pressure, the noise will differ, and you will know you are putting in a lot of pressure. And for the gadget freaks, there are some smart toothbrushes available. For example, this is Sonicare, and Oral-B has one. There are some smart apps that you can put along onto your app that you can download onto your phone, and it actually can show you how much of pressure you're putting in, and if you're putting too much of pressure, then you can set your alarm in the app, and that will tell you if you're putting too much pressure, and that will really help you as well. And I have a lot of patients, they using the app. So again, long story short, don't focus much on the name of the technique, whether you're scrubbing your teeth or not, or whether you're scrubbing your teeth or gums away, or you're going in a vibrating motion, going along the gum line to just do the cleaning, not only just the teeth but also the gums. That's what matters. And then for those people who are who are panicking about the gum receding, I highly recommend you use a power toothbrush, particularly something with an app that you can attach to your smartphone that will exactly tell you how you're doing your brushing, how you're applying the pressure and all of that, and that will really avoid all the problems that we are talking about.
All right, let's go to a really related question right above it. When brushing my teeth, should I brush my gums too? How should the gums be cleaned?
So the question is, when brushing my teeth, should I brush my gums too? How should the gums be cleaned? Absolutely. So whenever we are brushing our teeth, it is not just about the brushing your teeth. It's kind of like toothbrush is kind of like a misnomer, because you're not just brushing your teeth, and you're brushing your tooth as well as you're brushing your gums whenever you're doing whenever you're brushing. So the long story short, you should really be brushing your teeth, and you should really be brushing your gums. I always recommend whenever people are brushing their teeth, you divide that into quadrants. For example, like the top right and the top left, again on the bottom and the bottom right and the bottom left. So if you're dividing that, so then after dividing the quadrant, and some of these the toothbrushes we talked about, they have a timer on them. So for example, if the Sonicare brush has a 2-minute timer on it, or whatever the app that you're using on the phone, if you're able to see the timer, so then whenever you brush, like if for example you go you divide each quadrant into possibly like about 30 seconds, focus on the teeth for 15 seconds, and then focus on the gums for 15 seconds, however you want to do it. And normally I recommend you go on to each side. For example, like on the top right, you brush about 15 seconds on the outside and 15 seconds on the inside. Whenever on the 15 seconds, you divide 7 minutes to the gum and 7 minutes to the tooth. Same thing on the inside. So there are multiple ways you could monitor that. But the long story short, the answer to your question is you should be brushing also, not just the teeth, because if you may have good teeth, but you may end up having to lose the teeth because of the gum disease. And I've seen that happen multiple times, and patients are brushing their teeth properly, but they're not brushing, or they're not coming for dental cleanings, and they get a lot of gum disease, and they may end up losing them. So it is absolutely critical that you pay attention to your teeth and the gums, and it is very critical.
All right, so it looks like we have a few questions about flossing. So let's see on the second page here. I am not comfortable with string floss. Do I have any other alternative floss?
Okay. So the question is, I'm not comfortable with string floss. Do I have an alternative floss? So for people that you who are probably referring to the string floss here, this is the string floss we are referring to. So the challenge becomes for many patients that I see in my office, the way that you use a string floss. Some people, I teach them a technique, and then they say like, I'm not comfortable wrapping it in my middle finger, and I always wrap it in my other finger and index finger, and some people wrap it on the ring finger. So multiple ways you can do that. Some people sometimes like I would like to use it on my thumb. there are multiple ways you can do it. And then also, whenever we are talking about taking care of your teeth with good oral hygiene practices, the most important thing that you need are the brushing and the flossing. Some people ask me, okay, can I use a water pick or can I use some interdental brushes? So I tell them the two most common things that you need, are the most critical things that you need, are the brushing and flossing, and any other thing that you want to do is on the top of that. So for example, if you're using a floss, I want you to use it on a regular basis. But at the same time, if you are not a good floss user, or if you hate flossing, I don't want to kind of force the flossing onto you, and you will end up hating it and you're not going to be able to do the job properly. So if you really hate the flossing, if you really hate the string floss, so there are two options that you have. One, you may be hating the particular brand of floss that you may have, so you may want to run down the aisle at your departmental store or your drugstore and pick a bunch of floss. And there are multiple flosses that are available. You have a particular brand or a particular style of flosses that are available, so you may be able to pick up a floss that you may end up liking. Or don't stop flossing just because you don't like the string floss of any kind. So sometimes you do have some floss pickers or floss holders, so you're able to use, and this is definitely better than doing something better than nothing, right? So I definitely recommend you use that. And then particularly if you're not a good floss floss user, then maybe look for some alternative as to air flosser, or maybe the water picks, or the multiple options available. But I don't recommend you completely quit using the floss and look for a solution, but you try to do an alternative for the floss, as well as add some other gadgets that will really help you to keep your teeth clean as well as your gums clean as well.
And nothing will beat just regular old flossing, right?
Absolutely, yes sir.
All right. So next question comes from Reddit. Question about flossing back molars. How can you floss them with normal dental floss? I'm having trouble.
Where is this one? Right here. Oh, right on top. Okay. So the question about flossing back molars. So the question is, how can you floss them? How can you floss the back molars with normal dental floss? I'm having trouble. Again, there is absolutely one way you can use the floss. There are multiple ways you can that you get comfortable with the floss. My recommendation is, the way that I'm going to tell you may not be the best way to do that, or the way that I'm going to show you it may not work the best because you may be able to wrap the floss in a better way that is accessible for your mouth. The bottom line is, you want to go with any type of floss that you're using. If this is the floss, for example, like you got to go in a C-shaped motion, so you're not going up and down, up and down. So you got to curve, and you got to go around, curve, and go all the way down, and then come out. So just going up and down, that's not the way the flossing is. Because normally what happens is, whenever you have a tooth like this and you have a little bit of a curvature that underneath at the bottom that you should be able to reach, unless you're wrapping it on to the bottom, then you won't be able to reach those surfaces at all. So you want to be able to reach it effectively. And my recommendation is, there are a bunch of YouTube videos available. I'm sure a lot of viewers who are watching us on YouTube, and you can just YouTube it very easily. There are multiple videos, and we are going to put some videos also in the next few weeks. What is the best and effective way of flossing? So watch some YouTube videos and then see which technique will work the best for you as far as flossing the back molars. The bottom line is, keep it. It's kind of like I said, you got to keep the curve, like the C-shaped curve, go all the way down onto the tooth, not going up and down.
All right. So let's see. Let's go back to Cora for another question. My parents have poor dental health. Dad has gum disease and mom cavities. Does this mean even I would have bad dental health? I brush twice a day and do floss 3 times a week.
So the question is, my parents have poor dental health. Dad has gum disease and mom has cavities. Does this mean even I would have bad dental health? I brush twice a day and do floss 3 times a week. So the answer is no. Just because mom and dad had something, and you're not going to get that. However, if you're saying you're brushing only twice a day and you're flossing only 3 times a week, then possible that you may get gum disease, because you're supposed to floss twice a day, at least once a day. So you need to be brushing twice a day and flossing twice a day also, and that's a standard recommendation for taking good care of your teeth. If you're not following that recommendation, more than likely you may end up getting either cavities or gum disease. However, not because your mom and dad had something, you're not going to contract it. So your mom might have lost the teeth because of gum disease, your dad might have lost the teeth because of bad cavities. But if you do brush and floss twice a day, and if you're following not only the brushing and flossing, but also follow the professional recommendations by going to the dentist on a regular basis, you may end up keeping the teeth for the rest of your life. Think about this. I get this question. I get this question asked almost every single day in my office. Imagine, just because your mom and dad had diabetes, or your mom and dad had high blood pressure, you may not need to worry about that as long as you lead a healthy lifestyle. If you eat properly, if you diet properly, and if you do the exercise properly, you can absolutely overcome the problem of not having to have diabetes or high blood pressure. Same thing. You may have the probability of getting a gum disease. Your probability is a little higher because your mom had it. But can you overcome that? Absolutely, you can overcome that. Again, going back to brushing, flossing, and the professional dental care, those are very critical in keeping your teeth possibly for the rest of your life.
So you'd say oral hygiene is much more important than genetics?
Absolutely, yes sir. You can definitely overcome that.
All right, so let's go to a periodontal question. What is the frequency of peri-implantitis with dental implants in someone who previously had periodontal disease?
So the question is, what is the frequency of peri-implantitis with dental implant in someone who had previous periodontal disease? So what peri-implantitis, just to kind of keep it simple, peri-implantitis is the periodontal disease or the gum disease around the implant. Just like the periodontal disease is the gum disease around the tooth, peri-implantitis is the gum disease around the implant. Just because you had gum disease around the tooth, which is a periodontal disease, that does not mean that if you are going to get an implant, you are going to get periodontal disease around the implant, which means the peri-implantitis around the implant. Again, the answer goes back to what we talked about earlier. It depends on how good you take care of the implant. If you had gum disease, and because you had poor oral hygiene, now you got a dental implant and you're not taking care of the implant, can you have periodontal disease around the implant, gum disease around the implant? Answer is yes. However, if you had gum disease and you were able to get the gum disease cured, and now you are in remission, you don't have gum disease anymore. Now if you are going to get the dental implant, and if you are going to take care of the dental implant as good as you are taking care of the rest of the teeth with brushing, flossing, and other oral hygiene practices and the professional dental care, then the chances are you could keep a dental implant as good as you can take it, keep a tooth, and possibly again for the rest of your life. And this is one of the common questions that I asked a lot in my office almost every single day. And people ask me, hey doc, how long can I keep the implant? The answer is you can keep the implant for the rest of your life, and I answer by saying as long as you take good care of it. So the answer is as long as you take good care of your dental implant, you are not going to get gum disease around the implant.
All right, let's go back to another oral cancer question. This one's from Cora. What can I expect as part of a complete oral checkup? Any good checklist?
So the question is, what can I expect as part of the complete oral checkup? Any good checklist? There are multiple, like about, if you, just to give you an example, you think of like a car. So you go to website of Honda and they have a 105-point check inspection. You go to Toyota and they have a 96-point inspection. So pretty much like, depending on how you want to categorize it, every dentist may have their own checklist of what they are checking in for. The bottom line, we call it as a soft tissue exam and the hard tissue exam. On the soft tissue exam, which we are normally checking for oral cancer or any abnormalities related to the soft tissues around the mouth or the oral cavity, and the hard tissue is if we are checking for abnormalities related to the bone or the teeth. So those are the two common things. How you're going to categorize them after you kind of like those main two categories, soft tissue and the hard tissue, how many points they're going to check on each tooth or each hard structure, or how many points they have for the soft tissue, that really depends on the dentist. So bottom line, you want to make sure that whenever you're talking to the dentist, hey, am I going to get a soft tissue check, or am I going to get an oral cancer screening? Am I going to get my teeth checked or a hard tissue check? And those are the questions that you need to be looking for. And there is no such thing as the one is better than the other, or one list is better than the other, or one list is more comprehensive than the other, because it may be just a matter of categorizing how these lists are put together, and really depends on the dentist or the specialist that you may be visiting as well.
All right. Looks like we have time for about one more question, so let's finish it off with a good one. Let's see. Here we go. Is using mouthwash just as important a part of oral health care as flossing, or would brushing and flossing alone suffice?
So the question is using mouthwash just as important a part of oral health care as flossing, or would brushing and flossing alone would suffice? So the true answer is, do you really need a mouthwash? No, not necessarily. Some people, actually one patient asked me today, hey, can I just use a salt water rinse like right after the procedure? Absolutely, go for it. You don't have to necessarily use an expensive mouthwash to be able to take care of your teeth. Can you take good care just by brushing and flossing alone? That's what I do. I don't have personal preference to use a mouthwash, and I don't use it on a regular basis. If I have it, then I would use it. Sometime I'm in the office and I see the mouthwash and I use it. Sometime at home I don't really use the mouthwash as much as I want to. Sometimes I really don't see a reason for it. Although I brush my teeth like about 5 or 6 times a day, or maybe even more, I brush or floss my teeth. So the bottom line is, the long story short, you don't have to necessarily use a mouthwash to take good care of your teeth. Brushing and flossing alone are absolutely the best and the best possible thing you can do. But the question that I get asked a lot is, hey, I don't really like the flossing, can I use a mouthwash instead of the flossing? Or people ask me, oh, I really don't like the flossing, can I use the air floss? I really don't like the flossing, can I use the water pick? The answer is, my recommendation is, the bottom line, you need to be brushing and you need to be flossing. Those are the two best things you can do for yourself. But anything that you want to do, mouthwash, water pick, or air floss, or anything else you want to do, those are kind of like, just the add-ons, and those are the icing on the cake. And if you want to keep your teeth for a longer period of time, and if you want to keep them healthy, then those are the icing on the cake. But these are the most two critical things that you need to do, which is the brushing and the flossing.
All right, looks like that does it for us tonight.
Well, thank you so much, guys, and for joining us tonight. The Truth with Teeth, and this is an opportunity for you guys to ask any question that you may have with the teeth, or any oral hygiene, or anything related to your mouth. So we will be here next month to answer any questions that you may have. In the meantime, just keep sending your questions through YouTube or our Facebook channels or any other social media, or go to our website, Truth with Teeth. Go to our website, implantsgumcare.com, and ask Dr. V, and we will be able to answer any question that you may have, either in the meantime between now and the next show, or we will come back with those questions at the next live show. And we look forward to seeing you guys next time, and thank you so much.